So again, good afternoon to everyone. We will have our synchronous session for Nursing Informatics, NCM 110. And as we uh, discuss for this afternoon's topic on the Nursing Informatics model, I just want to ask if you have any questions, clarifications on the topics that was discussed last week during the asynchronous session. If none, can I see thumbs up? If you don't have any questions, clarifications, or any sharing in relation to the topic, do you have any questions before we proceed with our new topic for today? Can I see thumbs up if you do not have any questions or clarifications so that to proceed with our lesson for today? So it seems no one is having the thumbs up. So probably you may have questions. Okay, maybe I just waiting for the thumbs up. Thank you very much. So again, our topic for this afternoon is in relation to nursing informatics model. We have discussed data, information, knowledge, and wisdom, and these concepts are very important so that we could uh, analyze and understand more what nursing informatics is. So that's why we have this presentation of model for us to connect and align these concepts when it comes to the various projects, initiatives that either the government or organizations are gearing towards the direction of its objectives. However, let's start with the interactive session. Our interactive session is, do health informatics initiatives must be a priority project of the government? If yes, why? If no, why? So again, our question for today, to start with our discussion, our interactive session, do health informatics initiatives must be a priority project of the government? If yes, why? If no, why? This is on the perspective that we'll explore on our present situation, wherein you must also take into consideration that if we say priority project, it may entail also that these projects may entail also a priority funding. So with many issues and challenges that the country is facing, are we saying or are we considering that health informatics initiatives must be relevant now to be a priority project of the government? Please visit the slido.com with the code 3798127. And later on, I will be calling someone to share their insights, or anyone may volunteer to share your insights so that this could be also be shared accordingly from the questions that have been asked in our interactive session. Um, being in the professional while waiting for the answer, we being in the professional organization such as the Philippine Nurses Association, it has been it has been a consideration that there are many issues nowadays, even from the grassroots, from communities to the hospitals, in nursing schools. Health informatics are very relevant, and somehow there are some gaps that we really need to connect and to align, simply because that whenever there are projects or initiatives, or if we are considering continuity and sustainability, it will consider definitely funding, so that it will consider on the direction. Certainly, if there is a roadmap, then there must be a way on how the government or each government will probably consider the point that they will move forward and they will continue, even though there will be changes in the leadership of the government. So we are still awaiting for your answers. Again, visit the slido.com so that we will explore, or we can explore your responses on the question. Do health informatics initiatives must be a priority project of the government? If yes, why? If no, why? There is no wrong answers here. We are asking on this question certainly for us to explore that, even if it may not be a priority according to your response, or it could be a priority as per your response, this will really help us to learn on the perspective on how we will take part and contribute as a solution on these concerns with health informatics. So again, visit the slido.com, code 3798127. So we are still awaiting for your responses po. Okay, our BSN22 students. So while awaiting for your responses, I'll just continue with what I'm saying when it comes to health informatics. So today, as what I have mentioned, I am here to attend the Department of Health so that to facilitate the updates, because the roadmap has been set for the e-health of the Department of Health, and it ended already 2022. Since it's already 2023, we will have the reassessment on how these programs will continue under the Department of Health, Knowledge Management, and Information Technology System. And probably this will consider nurses. That's why I am here. Why nurses are being involved? Why I am here to represent basically these initiatives? It's because nurses are basically uh, contributors, major contributors and key players in the implementation of the e-health, of the national e-health initiatives. So let's have the first two answers. Yes, because increasing informatics capacity to build it helps to build the health department with the ultimate goal of improving patient care and health outcomes through the efficient and effective use of data. I agree with you. Your strong response here is related on the efficient and effective use of data. Because when you consider efficiency, we're considering on how we will maximize the 7 M's, the manpower, the money, the time for the moment, materials that we have, uh, those managers or the management that is very important in the implementation of the policies in relation to the health informatics. And the effective use of data will facilitate on how it benefited the public, specifically the health workers. So one of the responses here also, health informatics can be beneficial to healthcare system, but whether they should be a priority project of the government depends on the specific context and needs of each country or region. I really appreciate your responses because um, you are now aware that in the present context of each country, there could be possibilities that either this could be a priority project or not. One thing that we must take into consideration is the availability of funds. It's, for example, here in the country, we are considering that if this could be a national endeavor or this could be allocated for a national funding, then definitely it will benefit the healthcare system. The next question is how this will be embraced by local government units. Do they do they allocate priority funding for these projects of health informatics? That's another gap that or gaps that we have identified. Basically it may depend on those in the leadership, those in the management and leadership of the local government units, because if this will be a national initiative for funding, and if it may not be implemented in the grassroots, then that could be a gap that may not reach the services that it may improve, services that will be expected and reach the people who are beneficiaries of care. So we have an answer here that it's difficult to answer this one since we're all aware of the financial situation of the country. That's a good response because again, it's unexpected. It will for you it could be yes, because advanced medical technology may improve medical procedures that can enhance the life of Filipino citizens. So before we embrace technology as a way of helping the healthcare system of the country. And I think your response here will consider advancement. And that is very true in a sense that when we are gearing towards advancement, we're gearing towards on how we will prepare ourselves. But the next question is, are we ready? But if this will always be the question, when is the best time that we are ready? So it must start from now. So I think as nurses, as future professionals, you must think of the measures on how you will contribute and campaign to consider health informatics to be a priority agenda of the government, because it will consider efficiency of the services that will be cascaded to those who deserve it. Thank you so much. So their answers here is yes, because health informatics will be a priority for government. It can improve the patient care and health outcomes, because as what we have mentioned ever since, the patients are the core, okay, the core beneficiaries and stakeholders of healthcare within the healthcare system. And I think this will greatly support on the perspective that if our patient will uh, statistically decrease the number of cases, decrease number of mortality. So I think we are achieving the health outcomes. So I think this could be uh, a best solution that we will think, because it will benefit our patients, it will benefit our clients, it will benefit the community and the country as well. So I think if anything that will improve the system, um, this again will require funding. So I think that is the one that we really need to consider. Hoping each one of you here will consider this perspective to be an advocacy, for all of us to have an advocacy. So hoping we could serve as the voices of our people, that health informatics will really be helpful, and will consider this as an efficient way of serving our people and improve our healthcare system. It is considered here also a response that yes, because health informatics is gathering of data patients even in rural and urban communities. Okay, if we will have a centralized system of the data and information, it will benefit also on the timely delivery of services. So, di ba, if you can still remember the time that we discussed that uh, a pregnant woman delivered her baby here in the National Capital Region, or in Manila, with high risk pregnancy status. So there's a need to have those prenatal consultation records, and if the patient may not be coherent to respond effectively with those questions, the other way around is to facilitate retrieval of those basic and important significant information from the facility where the pregnant mother had her prenatal checkup. So that will promote patient safety as well, and that will consider efficient use of time for a timely delivery of immediate care to that pregnant mother. Should we say hi, this pregnant mother? So yeah, health informatics must be a priority project of the government because it helps improve our healthcare system. That's good, because when we talk about the healthcare system, it is not just only talking about hospitals. We are talking on the perspective of how these services will consider the four areas of healthcare delivery system, from promotive, preventive, curative, and rehabilitative phases of healthcare delivery. So the other response here is in relation to, yes, if appropriately funded. I agree with you. If this will not be appropriately funded, actually we don't have yet an e-health law. Hoping this will be one that can be lobbied to the legislators, so that if there will be a law on the e-health, then there will be a law on health informatics, it will require, or it will consider this as a priority for funding of the government. So I think that's one way that we can translate these objectives of what we are learning here, of prioritizing and funding about health informatics infrastructures. So yan. So ayan, may nag-respond po ng no. I believe that there are many projects that the government must prioritize. However, it doesn't mean that health informatics initiative must be ignored. So There's no wrong answer here. However, he or she is also on the perspective that uh, when we are talking about the Constitution, di ba, in the Constitution, meron talagang ano dyan, leveling for funding. And the highest priority for funding is education. Second is definitely health. So if there are many concerns in health when it comes to manpower, when it comes to facilities, and the infrastructure comes in when it comes to this health informatics. So maybe in the future this could be a priority. However, I also believe that in your response that the health informatics must not be ignored. It should be part of the priority programs as well. But for the funding for now, probably you are directing to that response. It may not be the highest, but it must be considered as a future endeavor of preparing our country to have an effective healthcare system. Thank you for those response. Again, how about yes, because health informatics leads to better healthcare, which in return makes every member of the community fully functional and contributing units of society. I'm really impressed with your responses. I agree with you kasi as what I've told you, your orientation in community from family, from individuals, family, communities, this basic concept will be more functional if we will gear towards the campaign and implementation of health informatics. Because seemingly, if an individual will embrace this advancement, and the families will definitely benefit from health informatics, and if the community is facilitating to improve the healthcare system utilizing the principles and framework of health informatics. So I think the fully functional community will be more contributing to the national level. So it must really start from individuals to communities, and thus it will have a clear picture on the national level. Very good example, response as well. So we have, yes, because health informatics initiative can provide many benefits, including improved health outcomes, increased efficiency, better patient experiences. Okay, so I think the three areas here you have mentioned are the ones or those factors that will really need to improve. And I think health informatics matters on these areas of efficiency, health outcomes, and patient experiences. If you will put yourself into a situation. Kasi a client naman could be a sick or a well individual. So we classify ourselves as well individuals. But we really need to consider health maintenance. And this health maintenance will allot some of the perspective that will continue awareness campaign, that will continue services that will be cascaded to the communities. So I think if we will use this advancement in the technology, then this will improve healthcare system as well. So those answers. So I may not read all of it, but I'm really impressed with your responses because you know now the social relevance of why we are having nursing informatics and health informatics as part of our profession. So we could be more socially relevant on how we will make this as an advocacy. Okay. So another is on how soon, if you will have your nursing research course, how will you will use the principal issues and challenges that we have identified in health informatics and translate it into research. And probably the findings in your research will be very useful, definitely, and very useful in terms of it could be translated into a policy, a guideline, an implementation of projects. So these are the things, or these are the things that we will really benefit from this course of nursing informatics. So probably I may call two or anyone may volunteer, two of our students who wish to respond on this question of, do health informatics initiative must be a priority project of the government. Hoping if anyone can answer no, it's okay. If you will answer yes, it's okay. Again, as what I mentioned, there's no wrong answers here. We have this interactive session for us to learn. If you will notice also, in most of the key terms that have been highlighted in this question, health informatics has the highest in the government. So if we will try to connect this, health informatics and government, so it means that the government has the role, definitely has the role on how to really consider health informatics as part of the system. And number five on the concept is patient and the project. So we will connect this, the patient as the core beneficiary of the healthcare, and thus the projects itself aligned with health informatics by the government can lead to the possible planning of having these initiatives to benefit the patients. And all of this can definitely help the healthcare system. So may I call on any of the participants? May I call on, how about RD? RD Covarrubias? Can you respond? Yes, RD.
My answer
Nagulat si
is
RD.
yes. My answer is yes po. And medyo same lang din po ng thoughts dun po sa mga naglagay din po ng comments. Especially
Okay.
po if appropriately funded po siya.
Okay. I will have question to you, RD, ha? If you will be a public servant, okay, if you will be a public servant, for example, you will be elected as a city mayor. Will you consider this as one of your priority project, RD?
Uh, um,
Where are you living, Miss RD?
nabotas po.
Yeah, no, for example, you are in Nabotas, and you will be elected as a city mayor. Will you consider this as a priority project? Again, there is no wrong answer here, ha? You can answer yes, you can answer no.
For me, yes pa rin po.
Okay,
Din po
so
talaga siya ng ng attention kasi na-notice ko din po dito sa Nabotas yung in terms of health informatics parang hindi po siya masyado pinagtutuunan ng pansin. Ayun po.
yeah, yeah. So yun, thank you, Miss Covarrubias. Nagulat ba kita, Miss Covarrubias?
Hindi po.
Okay. Thank you so much, RD. Okay, I think I see a raised hand. I think it's Jean. Mr. Teves, I think you raised your hand.
Arundin. Yes po.
Yes, you're acknowledged.
For me, yes po din. Kasi in today's data-driven world, health informatics has become an increasingly important field po. Kasi the ability to collect and analyze large amounts of health data po can lead to improved patient outcomes and more efficient healthcare delivery po. For example, yung EHRs can improve on the accuracy and the completeness of patient information, reduce the risk of medical errors, and help healthcare providers make more informed treatment decisions po. Tapos in addition, health informatics can play a critical role in public health efforts by tracking disease outbreaks, identifying risk factors, and monitoring population health trends. Health informatics can inform public health policies and interventions aimed at improving overall health outcomes. And given the potential benefits of health informatics, it is important for policymakers, healthcare providers, and researchers to prioritize this field. However, the specific level po ng priority and investment may depend po sa various factors as the current state of healthcare system and available resources po.
Thank you, Jean. So I think we have someone here who could be a prospective candidate for a public service. Yeah, I salute I salute your response because of the completeness and I think very meaningful yung response mo in a way that it already hit those on point responses from policy until it will be considered on the implementation and will benefit the beneficiaries of care. Thank you, Jean. Thank you, Jean. So we have an additional response here. Yes, because health informatics are enabling better collaboration and coordination. Yan, ayan. Whoever answered this one, I recognize your answer because it may not just only focus on nurses as in the implementation of universal healthcare. We need to have the interprofessional collaboration because this is an advocacy of the World Health Organization. So much as everyone must be an advocate of health informatics and nursing informatics as well, so that it will facilitate and improve our healthcare system from the community level up to the national level. So thank you for this response. This greatly emphasizes the advocacy of the World Health Organization. Okay, so I think those responses are taken into account. Thank you so much for these responses as well. Um, do we have other students who wish to share their answers? You may just raise your hand. Calling once, twice, thrice. Okay, seeing none. So again, this is another interactive session, which should I say very productive, because I also learned from your insights on how you will take part as future professional nurses, from interprofessional collaboration to community health nursing to nursing leadership to on how you will use this foundation skills that you have in the implementation of projects and initiatives that will really consider the core beneficiaries of care, who are our clients or patients. So thank you so much for the participation. To continue with our discussion, actually, it is very important to consider that we have started the framework of the pyramid of the DIKW pyramid, the data, information, knowledge, wisdom pyramid. Knowledge is one that has been considered on the learning from past. And this will translate into wisdom if you are already using it for decision making. The knowledge that we consider is probably learned by yourselves. It could be self-regulating, it could be self-paced. The one that we are doing now is facilitating learning from a perspective of me as a facilitator of learning and you as the one who benefited from learning. However, as a two-way process itself, I'm also learning from your responses and insights. If I may use your responses to translate this into a framework and submit this to a perspective of policy making, then I think that's utilization and that becomes wisdom. So every time that you are oriented with the performance of your functions as future professional nurses, it will always consider the acquisition of competencies through SKA or KSA, knowledge, skills, and attitude. Because this is a holistic way on how we will project professionalism. Other than that, we're also considering knowledge ourselves. We are considering ourselves as our having active involvement when it comes to knowledge. That's why it is indicated here that for number one, nurses are knowledge workers. Okay, what do we mean by knowledge workers? As nurses, okay, nurses being involved into healthcare across the lifespan and healthcare in various healthcare settings, if we're considering ourselves as knowledge workers, we are the ones that gathers data and translate it into information. It is very important because we are oriented on how we will formulate nursing care plan. And if we just only have the data and it's not translated into information, how we will gear towards formulation of appropriate interventions to every problems or health problems that we identified for these patients. And I think this information that we gather, that's why, di ba, initially in the nursing care plan, we have the subjective data and the objective data. Once we filled it with those information, it is through the skills of a nurse of having our communication, of doing interview with clients, then once we fill the subjective data, then those situations could be our reference on what will be the specific objective data that will be connected to the identified subjective data. And once we have indicated those physical examination findings, vital signs, diagnostic exam findings, these are already information. Why? Because upon analysis, you need from the data that is important for you to have a clear direction of your nursing care plan. We are generating information and translate this into an outcome that will be beneficial to the patient. That's why the term here that will highlight knowledge workers is we generate information. Okay. Generate information. If we say generate information, we use the information to the extent of how we plan and execute care management to our clients. So a typical example here, as what I have mentioned, is basically when a nurse is gathering, is doing data gathering on patient history, and we consider ourselves as knowledge workers on the extent that we are completing those information that is needed for the what that is needed by any authorized healthcare personnel who will be involved in the care management of the patient. However, when it comes to knowledge workers, since we are at the bedside 24 hours in the hospital, we are doing home visit to the families, it is very evident that nurses are the ones who are really doing interactions with patients. And I think if we're talking about reliability, we are the most considered reliable healthcare professionals when it comes to generation of information. And using the health informatics system, the other healthcare professionals can access on this and validate through further studies, through further diagnostic examination. So primarily, the the database is basically initiated by nurses. So that's why we are considering ourselves as knowledge workers. Okay. Second, knowledge acquirers. From the term itself, acquire. Okay, acquire. If we say acquire, this is on how we will use the term efficient means. Ayan. So dito naman, in knowledge workers, we consider generate information. In knowledge acquirers, we are considering efficient means. Again ha, if we will consider efficiency, it means maximization of resources. And what are those resources that I told you before? The M's. Resources such as materials, manpower, moment, that is referring to time, management, those who are considered as administrators, and other means by which it will consider storage and capturing of knowledge. Okay, so now, the knowledge that we consider is different from information. For example, if the information that the data has been gathered by the nurse and filled what is required, that is already information. Now, since this information had been entered into the health information system, it could be in the health center or it could be in the hospital, this could be used as a knowledge. To what extent? Because the information that we entered into that system can be used in the future by healthcare professionals if ever the same patient will need to have historical analysis of his or her health or medical condition. And who provided it? The nurse. We have the efficient means on how we acquire those information and store it into the appropriate either software or hardware, computer, or any gadgets available in the hospital or health centers. So as knowledge acquirers, the acquisition of knowledge is used efficiently so that it will benefit those who wish to access it in the future. Okay? So an example of knowledge acquirer is that of, as what I have mentioned, let us connect with number one. When the nurse collected data or gathered data, it is already information because it can already answer the condition of the patient and can be useful to formulate the nursing care plan. Now, how can we consider now as knowledge acquirers? For the next shift, for example, a nurse who will be on the night shift, the nurse who is on the night shift can access on on those information that had been entered by the nurse prior to her shift. And those meaningful information can be useful on how she will take part on monitoring of the client's condition. So, for example, with the care management of the nurse from the previous shift is on fever, then the nurse on the next shift consider these knowledge acquirers as the nurse on the night shift can access those information or those situations that the patient experienced fever, and he will take or she will take part on the next shift to continuously monitor the temperature of the client. That's knowledge acquirers. So that is being efficient. Next, knowledge users. Knowledge users naman, the nurse can consider individual or groups. Individuals or groups who benefit from valuable and viable knowledge. Pag sinabi nating valuable, this has had great impact on the patient's situation and families or the community itself. If we say viable knowledge, this knowledge has been used to basically prevent spread of infection. Viable means that the individuals and group uh, consider decision of doing or submitting themselves to vaccination because of the basic information provided by the nurse. So the knowledge users that we are saying here is that of the nurse as knowledge users can do or can use this for health education. Health education that is valuable for individuals or groups. Another, um, if the nurses are knowledge users, for example, there is a problem or there is a concern with disaster, okay, disaster preparedness and readiness, since for example the area itself had been declared on the specific alert level or storm level that will compromise safety, that will risk the safety of individuals and families. So the knowledge users, as knowledge users, the nurse can educate the preparation of the individuals and families during these times of disasters and calamities. What are the things to be prepared? The go bag. What are the health kits that must be prepared? Because these resources may not be available in terms or in times of emergency during disasters and calamities. Um, Communication channels that are very important during calamities, services and hotlines that must be available for the access of uh, our individuals or groups in the communities. So how nurses manifest her knowledge as knowledge users? You make this information valuable to everyone. Pag sinabi natin kasi valuable, it created an impact. Okay, so let's have a review for the first three. Nurses are knowledge workers because they generate information. Two, knowledge acquirers because they have considered efficient means. And knowledge users because they make this uh, information valuable to the beneficiaries of care, individuals or groups. Okay? So again, the communication lines, the chat box, you may raise your hand or unmute yourselves if you have any questions. Just do it anytime so that we will still facilitate an interactive discussion. Okay, now for the next knowledge nurses as knowledge engineers naman. Okay, if you will consider engineers, one thing that will pop your mind is design. But they are the ones who design. They are the ones responsible for designing a structure, designing building, designing various establishments, uh, public works. Ayan. So knowledge engineers, nurses could be knowledge engineers if you use this information, you use the information to design a specific process that will help our people, our beneficiaries, and our patients, and even the institution. Example, knowledge engineer. A nurse attended a specific training. What she learned from those training, she designed a specific protocol in the hospital that benefited the institution and benefited the patients on infection control. So let's go back to the situation when uh, the time or the first time that the public healthcare emergency was declared. There are no health protocols. There are no information related to the specific virus. We just considered basic knowledge on infection control and some of the associated or related literatures that are related to respiratory infection. However, the bottom line or the core concept in those situations during the public health emergency is there is a spread of infection. So how the nurse had been a knowledge engineer. She created an algorithm. The nurse created an algorithm in the triage so that it will classify patients, it will prevent patients from acquiring the infection, and for example, it will also facilitate the awareness of the patients on specific decisions when visiting healthcare facilities such as hospital. Did it benefited the patient? Yes, kasi in the prevention of the infection, even though there is still no health protocols that had been published or had been identified by the government. So this is what I'm saying. In the future, I even told you and even challenge you, when you will be in the nursing research course, think of innovative ways. You identified the problems already. You have already identified those challenges here in the country in relation to health informatics and nursing informatics. What you can do is to maximize now your neurotransmitters, how you will contribute to the society. For example, uh, disaster preparedness. This is still a problem, even though we do have those agencies and departments, but still, why there's still an increase in the number of mortality when a certain area had been hit by a disaster or calamity. So I think the nurse can facilitate on emergency and disaster in terms of designing an application that will alert family members to respond accordingly, even without the responders, the expert responders on their side. So when these emergencies happen at home, a nurse can design a specific application where the family members can access immediate response, even though very basic yung ways on how they will respond, even though they do not have any background on the medical competencies that are expected in terms of in case in times rather of emergency. So I think designing, developing, and implementing this knowledge, you can consider yourself as knowledge engineers. And I know that once again, You engage yourselves in research, you could be knowledge engineers. If some of you are very good in making applications, in designing games that is relevant to the extent that it is a game, but it will resolve concerns of the people for them to be more aware and for them to be more alert in times of these problems. So these are the ones that is really now it will really need the help. That's why even now, aside the DOH also invited the DOST. So that's why the Department of Science and Technology are also here in our summit, simply because they could be of help in funding those researches that will be very helpful in a national e-health program or initiative. Probably so, with your research findings, with your results of research, this could be very useful and may benefit the national level. Huh? Hoping each one of you will now think of how can you help our communities using the principle of health informatics. I will be the one who will be very much happy if I will encounter a research title that is relevant to health informatics or nursing informatics. Hoping you can now start conceptualizing, hoping you can now start reading those concerns in relation to health informatics, because we are moving forward in our healthcare system in this direction, and you as future professionals will be our key to make this healthcare system more improved for our people. Next, knowledge managers. Okay, knowledge engineers, they will design, develop, and utilize this knowledge. If we're considering managers, okay, managers, let's have the key term management. You will in management, it will consider plan, organize, direct, evaluate. Just these four. Okay? Similar with the nursing process, di ba? In nursing process, we have assessment, diagnosis, implementation, rather, assessment, diagnosis, planning, implementation or intervention, and evaluation. It's always a process. Knowledge managers, you cannot evaluate if you have not started assessment. You cannot implement any information if you have not assessed and identified the problem of the patient. That's why we are always oriented with SMART. We must be always be specific, measurable, attainable, realistic, and time-bound. On this aspect of knowledge managers, we can consider on the extent that I think yung processing of collecting expertise or collective expertise, kasi the term here processing the process itself, the plan, organize, direct, and control, and it can create the largest benefit. Pag it can create the largest benefit, it could be national or international. Kasi kanina, di ba, what we're thinking for the number 3 is, if we will go back to number 3, okay, I'm sorry. We'll go back to number 3, knowledge users. We consider this knowledge as valuable for individuals or groups. As we move forward, knowledge managers can now consider yung largest benefit. It's already the healthcare system for the national and international level. So I think if you are already in the position, or you are having function as administrators already, I think the innovation lies in your hands already on how you will consider and embrace technology that will really help your institution. So this will entail processing. You need to plan, you need to organize, maximize those resources, and you need to direct for implementation and evaluate, because this must be a continuous process. As knowledge managers, it's a continuous process on how you will manage continuity of this of what you have already established. So an example of knowledge manager is that of, if you are, di ba, we have already discussed yung chief nursing informatics officer. Ayan. Yung Chief Nursing Informatics officer rather, she is dealing with nurses. She's dealing with nurses who who are really who are involved in the hospital information system. This is in a hospital setting. So she's in charge on the acquisition of the required competencies and expected competencies of the people who are involved, or nurses who are involved in the hospital information system. So for the hospital to have the efficient management of the hospital information system, then I think the processing of planning, organizing, directing, and controlling or evaluating are the basic roles that the manager must consider, so that every feedback and evaluation will serve as a reference on how it will continuously improve yung quality of the services of the hospital. And again, every institution, even health centers, the beneficiaries of care are always the patients. Next, knowledge developers or generators. So sir, what's the difference between knowledge engineers and knowledge developers? Ang knowledge engineers, designing, okay? She will be in charge of doing this framework so that it will help the community. If we mention now knowledge developers or generators, this will consider na yung key terms natin on changing and evolving knowledge. Pag sinabi natin changing and evolving knowledge, we are now considering what the knowledge engineers have considered as a design, will consider now to develop for full implementation. Meaning, ako as a nurse, from the perspective of acquisition of learning in trainings, okay, I have plan in mind that I will use this in the institution. Now, how can I consider this? If I have already designed it as knowledge engineers, then it will already pilot its implementation in the hospital, and it leaded to the quality outcomes and feedback. So I think you can consider yourselves as knowledge developers or generators. Okay, so let us have a review. Knowledge workers, we generate information. Knowledge acquirers, we have the efficient means on how to consider information. Knowledge users, and on how we consider this valuable to individuals or groups as beneficiaries of care. Knowledge engineers, we design and develop the knowledge that could help the community and on the national level. Knowledge managers, we are using the processes of organize or plan, organize, direct, and evaluate so that it will benefit the largest group compared to rather other than individuals and groups on the national level properly. Knowledge developers is we are considering that change and this evolved knowledge that could definitely consider that hand as anyone can access information. So let's start with the nursing informatics model. Those that you have mentioned, I will now connect your responses to this informatics model a while ago with our interactive session. We have considered, you always mention healthcare system, and it was highlighted in our interactive session because everything that we considered for a priority project will always benefit healthcare system. Nurses are doing their role for an improved healthcare system. We are contributing and collaborating with other healthcare professionals directed pa rin in healthcare system. Now, since at the moment we are aware of the healthcare system of the country, how the nursing profession will help or can contribute to healthcare system. In the nursing informatics model, we can maximize the four areas: education, practice, research, and administration. In education, that's why health informatics have been integrated in the BSN curriculum for purposes for purposes of uh, letting our future healthcare professionals be involved in the endeavors of the direction of the healthcare system of the country. That's why even you are still nursing students, but you can assume already and have embraced your acquired knowledge, skills, and attitude to think already of what can benefit the society. That's why every time that you are being immersed into hospitals, communities, you can observe what is happening, and there's really a problem. There are really gaps that are happening, and that is the essence of why in nursing education you need to be immersed in the situation, because for you to have the realization. Other than that, other observation that you may have in the nursing education is the practice. For the professional nurses who are already in the field of practice in any field of specialization or areas, from communities to hospital setting to specialty hospitals, the nursing informatics model may vary accordingly on a situation depending on the facility. Most of the healthcare informatics or informatics are being applied and invested in private healthcare facilities because they are usually applying for an international accreditation. And I think it could have an edge if they have considered implementation of advancements such as health informatics. So a typical example is ISO. The processes are being being identified through a strong and established health information system. In this regard, we take into consideration also research. That's why I always emphasize that research is essential. Research is essential in terms of how we will consider ourselves to be key solutions to these problems of what we're encountering now. So I think these key solutions could serve as our way and direction on how we will have our mindset. You will be part of the solution in the future. And I think research itself, orientation and research itself could lead to the use of the technology and combine this interest into a solution that will benefit the future. And administration. If we say administration, those nurses who could be in the position and who could be having functions on the policy making, on institutional planning, on the appropriate government health departments and agencies that will have an impact on a larger scale, such as national, local, provincial, yaan. And I think if this could be a problem in every barangay, I think the one who is considering himself in leading these areas, this nursing informatics model could be very useful. Other than that, we cannot match, we cannot align solutions if we don't have basic knowledge on computer and information science. So we have already discussed this before, right? On what is the computer and information science. The computer science itself is the use of the software, the hardware, the processes, the storage, retrieval. The information science is on how you will make this information processed by those individuals who are competent. And nurses could be one. And if we will try to consider the basic knowledge or the basic concepts of data, information, and knowledge, data being processed to information, information to knowledge, transform. That's why it used the term process, because data will really need information. And that's processing, that's gathering, it's process, right? Then if this information will be very useful, okay, will be very useful for the individuals, groups, or the public, then this will be transformed on the basis for the nurses and other healthcare professionals in the intervention of care. And sooner or later, if this will be translated into a solution, policy, that will be wisdom. Okay? If you are if you are using it already. Kasi yung knowledge that you have acquired, if you will become a nurse leader someday, the knowledge that you have acquired could be useful. I have, di ba, usually, I will decide because I have learned from this, blah, blah. So that's the essence. That's why it is considered as transformation. So this is the nursing informatics model. And there are 5 key specialty areas. The 5 key specialty areas of nursing informatics are the following. We have clinical informatics, consumer health informatics, educational informatics, public health informatics, research in nursing informatics. Let's have an overview and brief background on this. If we say clinical informatics, obviously, if we say clinical, it's more on a professional relationship. It's the existence of healthcare professionals and the beneficiaries of care who are the patients. Clinical, it will always consider the core beneficiaries, the clients are the patients. If we say consumer or health informatics, it is on how we maximize the available resources and have this useful, meaningful, relevant to the patients, the professionals, the healthcare professionals, and the institution, and even to the government. That's why, pag sinabi natin consumer health informatics, why we have e-health, why we have teleconsultation, why do we have telemedicine. So ito yung tinatawag natin consumer health informatics on how we maximize these resources. 3, educational informatics. Educational informatics, it is on how we use the advancement and technology to benefit and upgrade the skills and competencies of our healthcare professionals. 4, public health informatics. If we say public health informatics, this is more on the perspective that the nurse is involved on on those activities identified in the communities and may benefit the people for promotion and prevention of diseases. So those services that have been identified in the Department of Health, how these services, basic services, health services will benefit, and that public health informatics could be useful for a nurse to make an application to identify high-risk pregnancies. That could be. Research in nursing informatics are being identified because if you are aware of RITM, specialty hospitals such as San Lazaro Hospital, National Center for Mental Health, these are specialty hospitals. And I think nurses are being involved on this perspective for research. And technology could be useful. Your competencies, your technological skills in research can be very useful in nursing informatics on how you will develop or even design a specific system that will have a timely response, since we do have now the law or act on mental health in communities. So that's why this will benefit soon our people in the communities to avail those services for mental health projects. Okay, I'll just give you a background of this framework. Okay, it starts with biomedical informatics. If we say biomedical informatics, this is on a perspective that we use the methods, the techniques, and the theories that are related to technology and related to the management of life and health conditions. So that's why bio, life, medical, health conditions, informatics, technology. So we have already identified the methods, techniques, and theories. That's why on the left side of this framework, research is the foundation from basic research to applied research. If we say applied research, this is the outcomes, or these are the outcomes of the basic research that we have identified and had become useful for the local, national, or local and on the national level. So, other than the biomedical informatics as a whole, we have the bioinformatics. So yung bioinformatics, these are more focused on cellular and molecular. Ayan. If you can still remember na we can already identify individuals if they have been uh, contracted with a new variant of COVID-19 virus. 'Di ba we can identify simply because of bioinformatics eh. We can identify individual and at the same time the differences of these variants from the specific Omicron, Delta, and from the new evolution of variants. And that's certainly considered bioinformatics. Another, DNA test. DNA test could be also the study of genes that will identify relationship. And that is also bioinformatics. Stem cell. The stem cell itself could be considered also as bioinformatics because it uses cells that will particularly consider a treatment regimen for a specific health condition. So these are bioinformatics. It focus on the cellular and molecular. Now, under the biomedical informatics, we have the health informatics. If we say health informatics, we have clinical, public health, consumer health informatics. Okay, so wala dito yung research kasi the research itself is already in existence from the biomedical up to later on yung outcomes that started with biomedical informatics. So sa health informatics, we have the so-called clinical informatics. That's why the focus is more on individuals, patients ito. Pag public health informatics, from the term itself public, it will benefit population. Pag consumer health informatics, it will benefit health information, access. Okay, just let's have an example on consumer health informatics. In consumer health informatics, it considered po yung e-health tsaka m-health. What's the difference between e-health and m-health? Yung e-health is health tools and services. What does it mean? E-health is, for example, an example of e-health is, for example, the government will facilitate the use of a specific information system or application that will benefit the hospital. So more on a broad perspective. It's more on the services. It's more on the manpower competencies that we have as nurses. Now, what is now the mobile health? The mobile health is obviously the use of the mobile, the Androids, wherein if we develop and design applications such as yung contact tracing, basic information of body mass index, blood sugar level. I think this is already an application that is being installed already in every Android phones. So, yan yung result of mHealth. At yung eHealth naman po is on how we will create a system that will benefit specifically on efficient access to information. Okay? So, before we start with the 5 key specialty areas, it's already 7 o'clock and I think you deserve a health break. Okay, so we have run through for almost 1.5 hours of our discussion and Maslow's hierarchy of needs. You need to hydrate yourselves, stretch your extremities for circulation, and somehow you can already have your early dinner. It's not an early dinner because it's already dinner time. But anyway, I'll give you the time for 10 to 15 minutes before we resume and complete our topic for today. Thank you very much and be back after 15 minutes. We'll resume at 7:15. Thank you so much. Okay, so we have already maximized the 15 minutes health break. Let us now continue with our discussion on the five key specialty areas. On the five key specialty areas rather, we have first the clinical informatics. What we have identified in the focus of clinical informatics are individuals. So that's why it will always consider the concept in the clinical informatics clinical care. The clinical care, it means that the collaborative care that are being administered and managed to patients, the health system that will benefit the patients on the services available, and the information technology is on the how the patients will access the basic information that is very important for his or her health status or condition. That's why in clinical informatics, it will always take into consideration the perspective on how it will follow through the knowledge. Kasi the background itself is very important, organizational skills and informatics knowledge. So um, that's why I even mentioned in clinical informatics that a nurse, a nurse will implement her acquired competencies so that it will benefit the patient. So anything, if you have managed the patient's the administration of patient's medication using the informatics for recording, that's clinical informatics. If you have recorded the physical examination findings and narrative charting, or rather the chartings rather, that you have for the narration of the health condition of the client from the start of your shift until the end, and upon monitoring, that's clinical informatics. Basically, when the nurse maximizes the use of this information system platforms, that will centralize all this information about the patient. That is clinical informatics. In the perspective of clinical informatics, it will consider the professional roles on how you will consider yourselves for assessment, system selection, marketing, education, and implementation. What we're talking about here is, for example, the hospital will purchase a hospital information system platform. Why is it that nurses are the ones being chosen to be part of the group on the assessment, on the selection of system, on how it will work, on how it will train nurses, how it will be implemented? It's because again, we as nurses are considering ourselves at the bedside 24 hours a day with patients. So I think this situation and consideration on the clinical informatics, it is on how we will take part on our role as professionals and how it will benefit the patient through the use of clinical informatics. From the time of admission, the nurse enters information. From the time the patient was endorsed or will be endorsed to the specific area and the nurse will manage it, still the access of information provided by those nurses who entered this information from the ER, and from the perspective of doctors, they have access those information on the use on the efficient use of the platform that benefited the timely delivery of care. So that's why nurses have been involved. Now let's proceed with consumer health informatics. In the consumer health informatics, there are uh, two beneficiaries: the professional health information system and the consumer health informatics application. If you will notice, sa consumer health informatics, as health professionals, uh, I can access electronic health record. I can access clinical report forms. I can answer biobanks. Biobanks meaning those examination results. Integrated care pathways. Ibig sabihin, the historical and hospitalization status of the patient. Clinical decision support system, it is on how it maximizes the sharing of information among the other healthcare professionals. And here comes the feedback system. Sa professional health information system, the focus in here is on how the healthcare process modeling. What do we meant by that? It is a matter of feedbacking system among health professionals. So yan yung consumer health informatics. So among healthcare professionals, and on the perspective naman sa consumer health informatics application is on how the consumer can access information through personal health record, although very limited lang, but at least can the patient have the right to know her results and how this could be interpreted. Siyempre, the doctors through the professional health information system can access his record. Yun nga lang, for the consumer health informatics application, it's very limited to avoid misinterpretation. But for the professional health information system, most of the healthcare professionals, authorized healthcare professionals, may have the access. Next is monitoring system. The patients can monitor his own access on vital signs. If it is progressive, it improves, or there are deviations. Personal health mobile applications. These are, I know you can relate on this because in your own applications, you have your own health apps. Even your steps can be counted. Even in your own watches, digital watches, it can already identify specifically yung vital signs, and it can alarm you if there are deviations on it. So these are what we call consumer health informatics. The feedbacking system is the use of the informatics that will benefit the patient. On the professional health information system, it is on the feedbacking among the healthcare professionals. And with this, it will have a standard communication level. There will be an exchange of information for a more holistic approach on the patients can access the doctors, and the doctors can access and have his health education directly to the patient through the use of consumer health informatics. This could also promote independence on how each individual's healthcare professionals and the patients can access their own information. Somehow, the consumer health informatics can be helpful on the aspect of disease prevention, the aspect of promotion, and even patient-centered care, because the patients themselves can already be informed, can already be aware of what to do. This is more applicable sa consumer health informatics if they are being discharged or they have been discharged. They can still have access on the basic information of what to do at home, even without the presence of the physical doctors. And I think this will help, this will really aid the management of individuals, of consumers themselves. Kaya nga consumers, the beneficiaries of care who are clients, the hospital stakeholders are the patients themselves, well or sick individuals. If the patients can access basic information on the services of the hospital, that's consumer health informatics. If the patient can already have reservation of consultation to the hospital using their hospital information system, that is basically already consumer health informatics. If it is related on the nutritionist, doctors, nurses, access and information, professional health information system. But to the consumer health informatics, it is on how the patient can help their self-management care. So self-care management rather. That's why I even mentioned to you before, when an elder who is at home can manage without a nurse. And through the use of a specific digital watch that can alarm the patients on the proper time of taking medications, on how it will be taken, it could be instructed through the use of the digital watches. Okay, so those are basic ways, and that's why it evolved. Actually, this was already been used even pre-pandemic, but it was strengthened on the use. Telemedicine, wherein it delivers services at a distance. Pag sinabi natin telemedicine is, for example, the basic services, for example, of the hospital, diagnostic exam. O nagkaroon ngayon ng mobile diagnostic services, wherein during the time of the pandemic, yung diagnostic mobile diagnostic vehicle ang pumupunta sa mga communities. to serve for diagnostic examination because the patients and the consumers are restricted to go to the hospital. So ito na yung deliver of services. And other than that, if there are patients who will not be anymore be admitted in the hospital, and that could be managed by palliative care. So the nurse proceeds to the hospital to deliver services with the phlebotomists, with the doctors who will be going to homes na using the mobile hospital. So I think these are telemedicine. And the teleconsultation is part of the telemedicine because even the patients may not anymore go to the hospital. They can have the consultation even through the use of various online platforms. Next, telehealth. Telehealth, which promotes health with interactive educational materials and self-management system. Okay, this is similar. This is basically similar on our mechanism in the school, wherein we have the Neo LMS. In the Department of Health, we have the so-called E-Academy. The E-Academy, the nurse can already have the modular training through the use of the E-Academy. It's through the use of the internet connectivity and through the use of the online platform. So that's also telehealth. Another telehealth that we can consider is that of the nurse, or rather the patients and the clients can already access basic information about emergency response, about the basic information on the medicines, adverse reactions. That's why during the time of the pandemic, on the vaccination rollout, many of the patients submitted themselves to the vaccination rollout because of the telehealth, because they can already access information even not physically in libraries, not physically in those facilities to access those printed materials, but it could be accessed through the telehealth or platform. The telemonitoring is which delivers patient data to clinicians. Ayan, telemonitoring, for example, sabi ko nga sa X-ray, sa radiographic studies, the radiologist may not anymore proceed to the hospital. However, the respective doctors can already access the results through the telemonitoring. So even in our laboratory results and e-prescriptions, these are the outcomes of telemonitoring. So just typical on a consumer health informatics, these are a typical example. We have health education website wherein hospitals have their sites wherein patients can benefit those basic information. Web health forum, the doctor or a specialist can also invite their patients on a specific health forum. For example, a diabetologist can discuss about diabetes complications. So she can or he can invite a forum among her patients. Patient portal is on the patient's how she or he can access basic information. Example, if the patient is hospitalized, he can access the updates on status of the billing, on the status of the progress of the results of her diagnostic exams, nurses reminders, doctors advices. So yan yung mga patient portal. And this is the one that I'm talking about, the fitness tracker application. In the fitness tracker application, these are usually na embedded or can be uploaded na in the various sites na, which could be very useful. So it could be through your phones, it could be through your laptops, and even through your digital watches. So yan po ang mga technology that somehow hoping future nurses in your nursing research, you can design these types of services na upgraded siya and can benefit the communities. Hoping you can learn from these principles and apply it into a research as an outcome. And soon, if it will be recognized sana by the DOST. So on the educational informatics, I know you are familiar with this. We have already applied the flexible learning system, and I think the various platforms that we have, the platforms that we're using now, the Neo LMS, and before we have the Moodle before. So the learning and teaching in a virtual classroom. This is somehow the use of the educational informatics. The synchronous and the asynchronous. What we're doing now is a product of educational informatics, which basically even the nurses who can still complete their continuing professional development through the use of the webinars. So these are the products of educational informatics, wherein learning resources can be available, seminars and trainings can be done online, it could be modular. So nurses can already exchange and share mga knowledge and acquired learning sessions from various trainings. So these are the products of educational informatics. Let us now proceed to the last two, the public health informatics. In the public health informatics, if you will notice, ang coverage, the coverage of the public health informatics is more on population. It will really benefit the communities as well. If you will notice, yung health information system, yung nasa bottom as are those na mga initiatives that had been utilized in the public health informatics. This is reporting. We can already identify, di ba, the number of COVID-19 cases. Outbreak management. It is on the time during the times that it declared already the pandemic, because majority of the regions are infected with the COVID-19. Cancer registries. We can already identify the leading cause of cancer here in the country. Risk factor surveillance. If we say surveillance, it is on how we monitor disease or health conditions of our people in the community. Pag mga risk factor surveillance, ito yung mga situations wherein if we have contaminated water, so pwedeng mag-cause ng waterborne diseases ito. So this will alert, or it will alert those individuals or those families. Yung newborn screening, this is registry wherein if there are deviations in the findings, it can already be accessed of how many cases have deviated findings in the newborn screening. So that's why on the process itself in the public health informatics, this is on how you will gain your confidence. Na you will start from conceptualization. For example, you have identified the problem of the community. You start with conceptualization on how you will resolve it, but integrate the concept of health informatics. Then you will decide. Ayan, papasok na yung concept natin on how you will become ano. Kanina kasi conceptualization, you could be knowledge users. Pag design naman, you could be knowledge engineers, di ba? So sa under development, you could be knowledge knowledge developers, and somehow it will generate this development pag implementation, evaluation until it is maintenance. Pag sinabi natin, if we say maintenance, these are already established programs in the community. That's why all of these services are available already in the community. So hoping our future professionals, you can already have this in mind. What can really help the community using these principles of health informatics? Somehow, the public health and epidemiology is important kasi it's more on the community health information. Pag sinabi natin epidemiology, it will talk about statistics yan eh. Mortality, morbidity rate, mortality, maternal, mga high risk rates. So yan, yung mga basic information that we could already access through the use of the public health informatics. And somehow, in the perspective of, eto na po yung this is what we are talking about, na the Center for Disease Control and Prevention. This is the one that is being considered po at nilalabi ito into law. Now, once we have, sa Amerika kasi we have Center for Disease Control or yung tinatawag natin CDC. So dito sa atin, it is already lobbied po na magkaroon tayo ng Center for Disease Control and Prevention, not just only in the National Capital Region, but all over the regions. So that those individuals from the regions may not anymore proceed to the National Capital Region. Okay? So it will develop yung public health information network because it can already access po yung sharing of information from one hospital to another hospital, from health center to another health center, from one professional to another professional. Don't you worry, we have naman the protocols that could be used at meron naman tayong Data Privacy Act. Another is the purpose of the public health informatics is information exchange service. What do you mean by that? The information exchange service is that of it will give the access for the public healthcare provider so that it will help them immediately on the decision, on the immediate decision. Prevention tayo, prevention is better than cure. So that's why for nurses, we can manage this accordingly if we can already access those information. So that's what we call information exchange service. Biosurveillance programs. Pag biosurveillance programs, ito yung a typical example on this yung sa COVID-19. We can already have the surveillance of how many COVID-19 so that during those times, if you can still remember, nagla-lockdown yan para hindi maka-affect sa other barangays. And that is on the perspective of letter D, vital statistics. Pag sinabi natin vital statistics, ito nga yung mortality rate, morbidity rate. So these are basic information that we can use and utilize for initiatives and prioritize these initiatives for prevention and promotion of health. Now, on the public health informatics, these are the sample na have been identified for shared services. Example, epidemiologic tools or outbreak. So ito yung mga reports that can be accessed by city health offices. Electronic medical records, yung hoping sa centers, sa mga health centers natin, hindi na siya ano na lang siya, i-access na lang yung may kanya-kanya na lang patient code. So pag tinype na lang yung code, it can already identify specifically yung access of the basic information of the patient. Another is electronic lab information. Ito naman yung we can already access the results of the diagnostic exam. Pag mobile-based system, ito yung example natin, yung contact tracing. Ito yung sana yung magkaroon tayo ng mobile system na ma-identify talaga yung mga high-risk pregnant women in the community. So these are the examples. I'm now giving you the idea, pero somehow not all of these are in place in the communities. That's why during the time that we have our discussion before, public health or communities talaga ang merong ang priority area that will really need to consider po yung perspective of the implementation of health informatics. Last but not the least, research in nursing informatics. This is connected also to the other specialty areas, from clinical to consumer health to educational and the public health. If we will have a centralized katulad ng RITM, that is a center for research. I think this will really help the healthcare system more efficient in such a way that, for example, here comes the healthcare system. The research centers that I'm talking about, a typical example is RITM. Pag nagkaroon na tayo ng Center for Disease Control and Prevention, ayan, magkakaroon na tayo ng mga specific system and tools that will consider research priorities or agenda. Kaya nga when I told you na can you consider the funding or priority agenda ang health informatics, some of you say yes, some of you says no kasi we don't have any basis. Pero if we see na, for example, do we consider na ba yung pandemic to endemic na kasi kumukonti na yung cases? We need data for us to have the basis and that will benefit the population of health. Kaya nga that's why yung data natin that had been accessed for the increased vaccination rollout, ano yung naging impact o nag-decrease yung cases, ano yung ating basis for the decrease of cases, decreased hospitalization and utilization rate. So if we have those data, we can confidently identify that this will really help, lalo na if we are lobbying for a specific policy. That's why yours truly are lobbying some of the provisions that will be enacted to law sa House of Representatives at saka sa Senate. And we really need data. Hoping this research in nursing informatics will really benefit and hoping you will embrace this in the future. And we will support to have the research center because it will these are the basic na magiging orientation ninyo in nursing research, and hoping you will maximize those skills para at least as nurses, you can contribute a lot. So I think that is one that had been ended as our topic for today. So I'll just stop recording.